I think that most of the excitement right now is really targeted more on the immunotherapy options. So certainly the checkpoint inhibitors, and not necessarily even just the checkpoint inhibitors. When you look at immunotherapy, as far as the T cell response goes, right now there are agents which can, move the immune process ahead. So there's stimulating agents, GITR and OX40, which we're looking at actively in clinical trials. And then you have the checkpoint inhibitors, which is, the checkpoint is, that's how the body recognizes self. So if the body recognizes something as self, it puts on the brake, right? So it says, we don't want to fight against this. But that's how a lot of cancer cells are able to avoid our immune system and earlier immune therapies. So what the checkpoint inhibitors do is they allow us to take our foot off of the brake, right? So, and T cells get activated, and it activates the cellular response against those malignancies, and that's why they're so efficacious. So you could hypothetically, and it's a driving analogy, right? So you turn on the ignition, right, and that's the antigen presentation, and then you have the gas pedal, which are those molecules that I just mentioned, and then you have the brake, which is the checkpoint. So hypothetically, if you can combine something where you're stepping on the gas pedal and you're taking your foot off the brake, that ramps up the immune system, maximally to fight these malignancies. So those are the exciting combinations that are certainly a lot of people are actually talking about.